Hello, everyone. I am on now. That's good. That's a good start. It's working. If we're at a health tech conference and the tech didn't work, that wouldn't be a great start, would it? So firstly, welcome to everyone today. Good morning. And thank you for those of you in the room for braving our bitter Manchester freeze that we've got at the moment. We've also got a virtual audience, I believe. Obviously, can't see you, but welcome to you. You may have made a better choice being in your own homes. That's if you've got the heating on. There is the cost of living crisis we're all more than aware of at the moment. Personally, I think I'd have been in my onesie, but let's not go there. So I'm Vicky Britano. I'll be your host for the day. I work at Mills & Reeves Solicitors. We're a national law firm with offices here in Manchester. I'm a corporate law advisor. So I work with businesses across the health tech and life sciences sector. So today is a particular interest for me. As a firm, we have sector specialisms in both healthcare and technology, and I'm really pleased to be joined by my colleagues Charlotte and David, who you will see in the first panel session. Don't tell anyone, David's from Birmingham, but he was born in Wigan, so I think we'll allow him to be here today. So turning to today, I'm sure we're all well aware of the issues with the NHS and the healthcare systems at the moment. Very topical, been on the radio pretty much every day this week. And on one of those sessions, the Health Secretary, Steve Barclay, was talking about the issues that he's facing at the moment with the staffing resources and the strikes or impending strikes. And he was talking about it's not just about pay issues, which I'm sure the NHS professionals would argue, but it's also about ensuring that technology is at the forefront of the healthcare systems. So today will be particularly interesting to touch on that and to see what Manchester can offer, because as we all know, Manchester's a great city. We're all very proud of our innovative history, and there's a huge amount of work going on in and around the centre and the region in respect of the sector. And so hopefully today's sessions with our panels and keynote speakers and our live demos will tap into some of that knowledge and experience and look at some of the challenges and opportunities that we're all facing. And I just want to give a very quick nod to our Circle Square location. It's a Bruntwood centre focused on innovation and collaboration. And I think those are two words that you'll be looking at today. As a firm, we're really happy to be located here. You'll hear from some Bruntwood speakers, Andy Roberts of Bruntwood later. And just where I'm standing earlier this year, Andy Burnham himself was stood here talking about this building, this location, and this corridor as being the centre of innovation. So if Andy Burnham can talk about it, so can I. We're certainly very proud about being here. So we've already had some exciting discussions this week amongst the panels. There's been some really interesting topics that's been discussed. So I'm hoping that you're going to find the day educational, interesting, and engaging. And if nothing else, I hope you all take away one new word today, which is interoperability. And Paul Brown's going to speak about that later. And I've said it right, I think. Good. So we do want today to be interactive. So any questions, pop your hand up. The Pro Manchester team are around to hand out mics. For anyone based at home, if you've got any questions, pop them into the chat box and the team will make sure that that's picked up. Before we kick off the day, I do have a few thank yous to make. Obviously, the first one is the Pro Manchester team. Been working tirelessly in making sure that today's a success, and I'm sure it will be. We've also got our sponsors, who are Mills & Reeve, Bruntwood SciTech, the Christabel Pankhurst Institute for Health Technology Research and Innovation, 6B, HGF Limited, Business Cloud and Cowgirls, all of whom we wouldn't be here without today. And thank you also to our speakers and panelists who will be keeping you engaged throughout the day, and to our innovators themselves who are going to be doing some live demos for you to take a look at throughout the day. As a final point, just the usual housekeeping. We're not expecting a fire alarm. There was one last year. I'm hopeful there won't be this year. If there is, just make your way back down the stairs, out the doors, and to the stairs in the amphitheatre, which is a posh word for the grassy area. And so let's kick off. It's time for our first keynote speaker, Paul Dennett. So Paul is the Lord Mayor of the city of Salford City Council. He's also Deputy Mayor of the Greater Manchester Combined Authority. His CV, as I'm sure most of you are aware, is extensive and impressive. And as well as his mayoral roles and other work that he has going on, he is also the joint chair of the Greater Manchester Integrated Care Partnership and deputy chair of the Integrated Care Board, a lot of which you'll hear about during today's sessions. So, Paul, I'd like to welcome you to the floor. Thank you.
Hopefully this will work. So there we go. Great. So good morning, everybody. And thank you so much for inviting me to be here with you today at the 3rd annual Health Tech Conference organised by Pro Manchester. I must confess at the start, health tech is not my background. It's not something I consider myself to be an expert in. I'm fundamentally a social scientist, so I spend my life observing people and how they behave ultimately, which is quite a useful skill, I think, when you're involved in politics. But I'm Paul Dennett, I'm the Mayor of Salford. As you've already heard, I lead within the combined authority of Greater Manchester on spatial planning, homelessness, and now health and care. And as you've already heard, I jointly chair along with Sir Richard Leese, the Integrated Care Partnership Board, and also I'm the deputy chair for the Integrated Care Partnership Board as well. So there's two things there. There's the Integrated Care Partnership and there's the Integrated Care Board. The board ultimately is the statutory body that reports into the National Health Service and the Department for Health and Social Care. Quite complicated governance, and we'll get onto that in a moment. There's also a joint committee that holds the partnership and the board together, which both myself and Sir Richard also jointly chair. But today isn't about governance, but it's useful to understand how the system does or doesn't work, maybe. And obviously all of this has been created off the latest round of NHS reforms, which, as we all know, started in the middle of a global pandemic. Not necessarily the best time to be reforming our much loved NHS. And as you've already heard, the NHS is facing many challenges at the moment. Some of those are staffing, some of those are finance and resources, and some of these issues are not new. I've long been somewhat critical, should we say, of really poor workforce planning within the National Health Service for many years. However, R&D and innovation is absolutely critical in terms of jettisoning, really, the NHS in a global, digital and innovative economy. So really important to the future of our NHS is digital and tech. But ultimately, I'm here to talk about healthcare and health innovation here within our city region of Greater Manchester. So here you will see Greater Manchester's digital ambition. It's about digital connectivity, making things better for people, utilising digital and tech with a very human lens in terms of, well, what does this do for people within our city region? What does it do to tackle issues of poverty and inequality? What does it do to make public services more efficient and effective? What does it do within organisations to ensure processes and procedures run so much better? But also within Greater Manchester, we have an ambition to ensure that the lack of digital skills is never a barrier to social mobility or employment within the labour market. And I think all of us in this room will know digital skills are really important, both from a kind of customer, consumer point of view, also in the workforce itself, but also as a citizen in terms of accessing services. And we have huge challenges across the city region with regards to digital literacy. But also it's about where public services are intuitive. And I stress the word intuitive in all of that. That speaks to the importance of data analytics, big data, and how we resource things off the back of taking a data-rich approach to how we deliver public services, whilst also ensuring that they're joined up, available to all. I remember within my own local authority, we had long conversations about, is this digital first or is it digital by default when we were transforming services within the local authority? And for me, it is very much about digital first. This isn't about routing everything through digital platforms, because inevitably there are always going to be people that need that human interface and that one-to-one customer care ultimately. And digital first for me also speaks to some of the challenges around access, skills, and obviously we are in the middle of a cost of living crisis at the moment, which makes much of this all the more challenging for local authorities, businesses, and certainly our voluntary community and social enterprise sector. We are a fast-growing digital ecosystem here in Greater Manchester, and you can see there, £5 billion. And that is across communities, that is with businesses, academia, public services, all working together to create opportunities and innovate and also invent. But also we look at that through the lens of inclusive growth. This isn't about necessarily the age-old trickle-down economics where you just get the investment in and all boats will rise. This is about looking at how we do R&D and innovation in a very different way, where growth genuinely does benefit the people of Greater Manchester. So our ambition for Greater Manchester is ultimately to be a world-leading city region recognized globally for digital innovation. And what we're trying to do in all of that? Well, you can see there at the top, help the NHS to support broader socio-economic development, improve population health, tackle unequal outcomes and access, and enhance productivity and value for money. These are critical aspects of what we're trying to achieve here through the integrated care system. And you'll see as well, between 1 and 3, it operates at different levels. We talked earlier about the Integrated Care Board and the Integrated Care Partnership. That operates very much at a city regional Greater Manchester level. So it encompasses all of this. Then you can see we look at this also through the lens of locality, taking local authority boundaries ultimately as the spatial dimension for considering what happens at that level. And then also we go beyond that to the neighbourhood level. And many local authorities across Greater Manchester at the moment are engaging in different ways of doing public service, ultimately thinking about communities, natural boundaries, and how we work with anchor institutions within place to deliver services in a different way, rather than the very centralised approach of everyone being required to come to the town hall to access services. Lots of change is happening. And I guess the important point in all of this is all of these different layers are inextricably linked. And these are really active conversations at the moment about what sits at what level and how do these different spatial dimensions talk to each other when it comes to the delivery of health and care across the city region. And then obviously some of this is further complicated when you start to think about the wider determinants of health and well-being, the work of Sir Michael Marmot. You know, there's many things from a non-provision point of view that have an impact on people's health and well-being. And actually, we need to quickly get into that space. And that's one of the challenges we have in the NHS at the moment, is how do we deliver with the immediate challenges of post-COVID, growing waiting lists, demands on our workforce, reduced finances, whilst also at the same time trying to deliver on the wider determinants of health and well-being to ensure people live longer, but also live healthier without needing to access health and care services as long as they possibly can. So for me, all of this doesn't sit in a silo. It is very much connected with that wider determinants of health and well-being. And Greater Manchester's digital ambitions, if you like, cover all of this, both at a GM level, at a local authority level, and at a neighbourhood level. And I think it's really important just to acknowledge that. So, viewing Greater Manchester through an NHS academic and industry lens. So, as we all know, devolution has decentralised power and budgetary control from Westminster and Whitehall. And good examples of that are things we've been doing on skills, transport, health, care, and all the work we've been doing through the Combined Authority on public sector reform. It's been really interesting being the lead on homelessness and rough sleeping, and the journey we've been on with our National Health Service to actually play an active role in supporting what we do here within the city region. What I would say about devolution, though, is it's certainly not job done. For me, devolution is always in this sort of state of becoming, and you're probably aware both Greater Manchester and the West Midlands has been chosen as one of the devolution trailblazers to further deepen our relationship with Westminster and Whitehall, and hopefully make progress on delivering further devolution across the city region. You'll see here as well our high growth sectors, specifically relevant for this agenda, are life sciences, advanced manufacturing, financial and professional services, creative and digital tech. And health innovation, importantly, is a mayoral priority within the combined authority. So what we're talking about there is advanced therapeutics, med tech, diagnostics, industry 4.0, artificial intelligence and data science. Many things that I'm clearly not an expert on. So also, it's important to acknowledge in all of this, some of our city regional strengths within a global economy. We are ranked 34 globally for innovation in Greater Manchester. This isn't starting from ground zero. We have a lot of expertise already within the city region that is enabling us to really be at the vanguard of innovation R&D within a global economy. 25 Nobel Prize winners as well, decent record there. The second largest digital turnover in the UK at 2.9 billion, and home to 80 of the top FTSE 100 companies. So quite some achievements. And obviously the challenge then becomes, how do we link industry with academia, with what we're doing in the public sector? Recently, you may be aware, we've also signed a memorandum of understanding with Innovate UK, and that's to really accelerate some of the work we're doing around net zero, life sciences, creative industries, health and software, committing to delivering to Mayor Burnham's vision, if you like, for a greener, fairer and more prosperous Greater Manchester. Fairer, again, speaks to that inclusive growth agenda we talked about a moment ago. And all of this is geared towards being an innovation economy here in the city region, working with academia, the public and private sector, but also working between national and local government. And for me, importantly, it speaks to our historical agenda, really, in terms of the North being known as the centre for the Industrial Revolution, our great northern cities and towns, and how through innovation and R&D, we can reindustrialize, creating jobs and opportunities, tackling poverty and inequality. Apologies for the sniffles, it's that time of the year. So the problems we're trying to solve through innovation. So I think we all know Greater Manchester has a diverse population with a diverse range of complex needs. We have below average life expectancy for men and for women. We have an aging population. We have children facing disadvantage in their early years. And this is ubiquitous, in my opinion, with other city regions around the world. This isn't special to Greater Manchester. These challenges are faced around the world. And in addition to that, obviously, our public services are facing unprecedented demands and stretched resources. So there are significant challenges here within Greater Manchester, and I think we have to be honest about those. But technology ultimately has a major role to play in addressing all of these challenges. But the issue for us is, how do we actually make it happen? And you can see there some of the other challenges we face. The innovation cycle in healthcare is too slow. The uptake of innovation often is unequal, with unequal impacts across the city region on people and communities. And innovation partners struggle to engage with our complex systems. So those are the challenges, if you like, that we face. So there's clearly more to be done in this space to actually improve how we do innovation R&D and how we then operationalize that within the city region and within the global economy. Because some of this is about jobs, it is about exportation. I'm being told I'm going on far too long. Sorry about that. So we'll skip through some of this. I mean, this is around innovation, digital equalities. I mean, we've talked a lot about the importance of digital exclusion. What I'm trying to illustrate in all of this is that the NHS see this as a really important aspect of their long-term plan. We do in terms of the work that councils and the combined authority have been doing. And what we need to do ultimately is join all of this up in terms of how we operationalize this to tackle digital exclusion. So the healthcare and care system are also making a commitment to tackling digital exclusion. And what you've got here again are those different levels that I tried to articulate earlier on. At a GM level, you know, digital inclusion is part of digital and data strategies. It's part of our GMS, if you like, and the integrated care systems work. We're doing mapping at a Greater Manchester level as well, because having an evidence base to understand this on a spatial dimension is really, really important. Locality level, the importance of our relationship with the voluntary and community sector, and then organisationally, you know, how we train people to become digital health champions within our respective organisations is really important. We have things called digital eagles in the city council who are experts on digital and train other people within the organisation whilst providing support to residents. So this illustrates ultimately the innovation that's happening at the moment across Greater Manchester. There is a lot of it. I mean, it's happening right now. So you can see on there the rollout of the GM care record, providing more informed care for over 180,000 patients being accessed each month, providing a platform also for research. Health Innovation Manchester's referenced on there, over 60 innovation projects across their current pipeline. Also leading world-class research centres, leveraging huge amounts of money, which you can see down there at the bottom, working ultimately with industry to benefit our citizens and attracting inward investment to develop, if you like, new technologies, new pathways, new drugs, a whole host of things. I won't go through all of these case studies, but these try to unpack some of the R&D and innovation proposals that I've already highlighted there. So this is the GM care record. 3.1 million patients being supported, 17,000 district users each month, 15 new clinical pathway users cases in development. And then we're scaling this across over 550 health and care providers across the city region. And we're also benefiting, as you can see there, from research studies around the COVID-19 pandemic, 25 of those. And we're pooling investment here. This is important. The collaboration piece that I talk about is really important here because so often we talk about competition within markets, but actually, if you're serious about R&D and innovation, it's about complementarity and it's about collaboration, not necessarily just domestically here within the city region, but thinking about that on a pan-global scale. Other things we're involved in are the cholesterol reducing real world study. Again, that's happening now. There's a £50 million national programme associated with this. Greater Manchester are getting 5 million. There's 2 localities within the city region that are test sites for all of this. And obviously all the learning from this informs that global real-time study that's happening around the world. And then finally, in terms of a further deeper dive into some of the work we're doing, the GM secure data environment for R&D. I won't go into that, but I mean, these slides will be shared with colleagues. And that brings me to the end of my presentation. I think all I want to say at the end is the importance of R&D and innovation within a global economy currently is absolutely massive. And I say that because the jobs of the future, many of us don't know what they will be. Investing in R&D and leveraging that within health tech is going to be so critical for Greater Manchester, both in terms of how we deliver public services, how we tackle poverty and inequality, but also how we contribute to UK PLC within a global economy in terms of creating businesses and startups of the future, but also creating really important jobs to genuinely demonstrate that we are reindustrializing the north of England. Thank you very much.